Today, we're going to be talking about what happened to Dr. Jordan Peterson back in 2018. For those of you who don't know me, I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist and expert in psychiatric drug side effects, specifically benzodiazepine-type injuries. And all I do all day, every day is help people come off these medications. And so I'm going to give you my perspective on what happened to Dr. Peterson. For those of you who were following his story, he's a professor of psychology from Canada who really rose to fame because he was anti-woke and he was very outspoken about it. And at the height of his fame, he was sidelined and kind of just disappeared. He just fell off the face of the earth because he was having, what the news called a benzodiazepine addiction problem. Now, this was far from the truth. The truth was actually much worse than this. He was having way more problems. He was actually having a different problem completely. It didn't have to do with addiction. But this is still widely misunderstood. And one of my coaches, Nicole, sent me this clip about Candace Owens talking to Michaela Peterson about what had happened to her dad back in 2018 and then the years afterwards, which I think is really interesting to comment on because it really touches upon how poorly understood benzodiazepine injuries and side effects are. We're going to be covering what happened to Dr. Jordan Peterson and some of the most common misconceptions about this now. So let's go ahead and check out the video.
And I think it's funny that you mentioned ad hominem attacks after you released a 26-minute video detailing my dad's benzo withdrawal and allergic reactions out on YouTube. It's just funny, like you're going after me for ad hominem.
Well, actually, look, now you mentioned that, I was going to bring that. Well, hang on. I was going to bring that up. For those who don't know what you're talking about, let's play a little clip from that.
Oh, I didn't sleep that month. I didn't sleep for 25 days. I didn't sleep at all. I didn't sleep at all for 25 days.
How is that possible?
I'll tell you how it's possible. You lay in bed, frozen in something approximating terror for 8 hours, and then you get up.
Oh my God.
Oh yeah, not
and
good.
This is from cider.
I feel like Joe Rogan is all of us. I'm listening to that and it doesn't pass the sniff test. I'm just going, wait, what, apple cider? You didn't sleep for how long? What are you talking about? He brings up Michaela, by the way, that's his daughter. We're going to get into it. That explanation does not make sense to me whatsoever. Again, I'm not a doctor. I'm not claiming to know how everybody's body reacts to apple cider, but I just don't think that you wouldn't sleep for that long because of it.
So I'm going to actually jump in here because we're starting in the middle. What had happened to Dr. Jordan Peterson was, it's really actually quite a tragic story. His wife was sick with cancer, and obviously he was famous. He was dealing with unprecedented levels of fame, and his wife had cancer. And so he started taking a benzodiazepine medication. And slowly he went up on his dose, but not to a level that was, beyond, what doctors would normally recommend. It wasn't like a crazy high level. It was just a normal therapeutic dose. And he starts to get really sick. And then they start to try and remove the medication, but it doesn't work. And he's really unwell. And he also begins to start reacting to things that he didn't used to react to before. And that's why they're talking about this apple cider vinegar. Now, in a little bit later on in this clip, I think they start talking about sodium metabisulfate, which just turned out to be this sensitivity that Dr. Peterson had after he developed this benzodiazepine injury. And that's why he has these really strong reactions. And it may sound crazy to you that someone could have a side effect to like a chemical in like apple cider vinegar or something like that. But I see it all the time. So I treat a lot of these patients and they react to things. Sometimes it's just like histamine. I have some people react to like bananas and different types of foods, and it just flares up their nervous system. Because what has happened to Dr. Peterson, he didn't have like an addiction problem. He had a brain injury is what happened. He developed something called benzodiazepine-induced neurological dysfunction. Now, usually this happens when someone is rapidly pulled off the drug. From previous interviews that I've heard from Michaela and Dr. Peterson, I think they do a really long one on her channel. This just like developed gradually over time for him. I don't think it developed when he tried to come off the drug. I think he was already sick before then. And then when he tried to come off, because his nervous system was already kind of poisoned by the drug and he'd become toxic, that's when he was really trapped on it. And there was nothing that he could do to make it better. When he tried to lower it, it hurt him. When he tried to go higher, it hurt him. And eventually he ended up going to I think, Serbia or something like that to do some kind of like induction where they put him under to remove the drug. This is all publicly known. And I think in the interview that Michaela does with her father. But yes, what's happening to Dr. Peterson is that he's developed neurological damage from the drug. It's a rare side effect. It's just been added to the FDA labels in 2019. It's not addiction. It is not addiction at all. He had neurological dysfunction, and that's why he's reacting to all of these things. So yes, it does seem unusual, as Candace Owens says, but it totally can happen. Let's keep on going.
Okay, so
Where
Michaela,
was the ad hominem attack?
Well, I'll come to you in a moment, Candace. Michaela, how did you feel when you heard about that?
Well, I think it's funny because we're connected online, Candace. So if she has an issue with my family, she could literally just message me. Her husband has my husband's phone number, So it's just like a weird thing to do. I don't know where it came from. As for the apple cider reaction, I've gone over this so many times, but it's fair if Candace didn't know this. Although I don't know why you would make a 26-minute video without doing some research. It wasn't apple cider. It was a sodium metabisulfite allergy. And it was near anaphylaxis. And people don't sleep in that state. And when we went through that, which was horrible, it was horrible. We had a hard time with the medical system. We didn't know how to treat it. It took us years to figure out what the allergy was. If you talk to a doctor and say you have that allergy, they go, "What's that?" It's not a common allergy, but it's not uncommon. You can Google it. And it just seems a little bit cruel to pull that up. You also started that video.
So this is something that's really common. I mean, from a lot of my other patients who develop this injury, people don't believe them when they say they're reacting to things. They'll have an alcoholic drink or some caffeine, or they may even take a drug that they used to tolerate before, like an antidepressant after this happens, or some food. And because their nervous system is now damaged really from the drug, because the drug is damaging neurons, that's what happens. They start having intense reactions to things. And people look at them and they say, well, you never used to react to that before, or I've never met anyone with that sensitivity. You're crazy. You're hysterical. This is in your head. It doesn't surprise me that Michaela and her father, Dr. Peterson, had such a hard time getting people to kind of believe what was going on, because this side effect is really not well recognized by the medical community. Let's keep on going.
By saying, why is Jordan Peterson's male audience, diminishing? Let's get into it, which is it's manipulative, right? It's not true. So you have this giant audience, Candace, and you say these things as if they're true, which confuses people when they're not. So I don't know what to say about it. It's aggravating, and I think it's a mean girl high school tactic.
So what Michaela is talking about here, and I know we haven't watched the other video. You can on Candace Owens' channel, but the whole context for this 20-minute bit that she did is, why is Dr. Peterson's audience declining? And her argument is that he put out this book that was all about personal responsibility, clean your room, stand up straight, tell the truth. And then people found out that he had this quote unquote addiction to benzodiazepines. And there's something inauthentic about that, because how could you be preaching to have, other people to have your life in order if you are quote unquote addicted to benzodiazepines? That was Candace's argument, saying that, people kind of lost faith in him because they thought that was some inauthenticity, which is bullshit, by the way. It is absolute bullshit, because he was taking the medication at the normal prescribed dose, wasn't abusing it in any way. And then he developed a drug injury. He developed a neurotoxicity where anytime he tried to come off of it, his nervous system was so unstable, he had debilitating symptoms, and then he needed to go to a specialty clinic to get help. So Candace was trying to paint this picture that he was just being inauthentic in some way, but it was just completely misunderstood and wrong. And so that's what Michaela is responding to now.
Okay, Candace, you're a mean girl.
Again, accusing me of ad hominem attacks when I feel like she's engaging in them. Just to be clear and to contextualize this clip, Jordan Peterson was trending. I cover trends, I cover the news, and I think it's fair to cover topics when they come to the surface. He was essentially tweeting ad hominem attacks that were written like sonnets. It was very bizarre, and people were going, what's going on with Dr. Jordan Peterson? And it became a Twitter trend. And so I covered it. Is there something wrong with covering a trending topic? I certainly don't think there is, or I wouldn't have a podcast or things to speak about. Regarding your father's audience, there were a lot of people who, after his addiction and feeling like he was not honest about his addiction, a lot of men who sort of switched off from Jordan Peterson. I mean, that is just a fact. I understand and respect that it is your father. And so you're naturally going to be defensive of him. And if it was a family member of mine, I would naturally be defensive.
I just want to jump in here. People use this term addiction so freely, and it can be easily understood. So like, yes, you could say maybe he was like quote unquote addicted to the medication in some way, because after he got sick, when he tried to come off of it, he couldn't because it was so uncomfortable, because his neurons were damaged. Just a slight amount of reduction was just excruciatingly painful for him and damaging. So yeah, maybe he is addicted, but actually the more accurate term for that is he is physiologically dependent on it. And that means like his brain had just adapted to it, and removing it was causing withdrawal symptoms. Now, in my world, when you're actually like a clinician and you use these words with precision, addiction doesn't really mean physiological dependence. It kind of means that maybe you're abusing the drug in some way to kind of mask uncomfortable feelings, or you're taking it because there's some like high or euphoria there, or, maybe doing like dodgy things to get it, and you're taking it at really high doses. And so when you use the word addiction, there's all of this like colloquially, which I believe she is doing, all of this like kind of baggage of like bad behavior and off stuff comes along with it. So it's really unfair actually to use that word, and it's inaccurate.
But to pretend like I plucked the topic out of pure air simply to be a mean girl, and not because it was trending, literally saying that people are wondering what's going on with Jordan Peterson, I think that's you not being very genuine about why I was discussing it. And I think that I was tremendously respectful. I also paid him a huge compliment. I think his book and what it did for men worldwide at a time when men were being completely stomped on and masculinity was being questioned. And I said I would never remove that. I would never take the credit away from him. But there have been some things that have just registered to the public as odd. I didn't make your father trend that day. So I think he's able to deal with a little bit of criticism.
You want to respond, Michaela?
I guess I'm just confused because Candace said she wasn't into celebrity culture. So then I thought maybe it was just a personal thing, if it's not about a celebrity, but maybe I just got that wrong. I don't know what else I can respond to about that. People can listen to. Can I finish? Thank you.
She's clearly pissed off, and I would be totally pissed off if someone was saying a lot of stuff that was inaccurate about someone I cared about. I mean, you can feel it.
People can listen to the 26-minute. Like, you can say, oh, I said something nice at the end. It's the same thing when you say these things and your tone is off. You can be like, oh, tone doesn't matter, but you say things sometimes in a bit of a manipulative fashion to get people to think a certain way. And then when people bring them up, you go, well, those aren't the words I said, but tone matters too. Anyway, people can go on YouTube and listen to the 26-minute section of your video on Dad and see what they think. I think it's high school mean girl tactics. I don't care if you think that's ad hominem either.
And I'd agree with her if you listen to it. And even if you listen to her now, the whole like tone and the presentation is like, Dr. Peterson is a liar and he's inauthentic and he's been caught out. And so, we're going to kind of name and shame it, which is awful because he's suffered from a serious medical problem.
Candace?
Well, I would just say that when I was referring to celebrity culture, I meant worshiping people because they're celebrities. So I think that would make me ideologically consistent. And like I said, he was trending that day. I covered it as a trending topic. It's not a mean girl thing, but it might feel that way to you because it's your father and you have a personal relationship. I can apologize if you are hurt from me covering the news. But like I said, we have to develop a thicker skin when we're in the public. How many things are said about me routinely on a daily basis? If people want to cover after I have, an addiction and people say, hey, after this, I think people lost faith in Candace Owens and that becomes a trending topic. I think that's fair game. It may not feel good to me, but I think that it would be fair game and it would be newsworthy.
Okay.
You do know that 1/5 of Americans are on psych meds, right? Are you aware of the statistics?
Yes.
Are those all people with
Correct.
addictions? Like, is that your view of people on psych meds just in general?
No, your father spoke out about his benzo addiction. So I don't understand why you're asking.
Yeah, no, benzo dependence. Maybe you don't know anything about this. If you're on a psych med long term, you form a dependence on it and it's very difficult to get off of. They're starting to teach this in medical school. It's a disaster because so many Americans are on psych meds. So yeah, he suffered from psych med withdrawal because they they make you form a dependence on it, especially long term. Now, calling it an addiction as if he was on heroin or something is manipulative. So when we talked about it and we were very honest about what was going on, part of it was to spread awareness that 1/5 of Americans are on medications that cause dependence and don't know it. It's horrible.
The thing that she's missing here, and she's right, this is totally right about the dependence, but the thing that she was missing with her dad, and I think what makes it really confusing to a lot of the public, is he had a benzo injury. He had benzo-induced neurological dysfunction, and that was why it was so hard for him to come off. Because like she said, with 20% of the population on these meds, everyone knows someone who's on them, or they've taken them themselves, or an immediate family that has been on it, and they've gone on and off and they haven't had any problems. And so people hear this and they say, well, that's not that big of a deal. But if you are the unlucky person where you're taking an antidepressant or a benzo and you get this kind of brain damage from them, and it does happen in a small group of people, it's become a lot more widely recognized, they can be nearly impossible to stop. And that's the piece of context that I think was really missing from the Jordan Peterson story that just made it seem so strange. But let's keep on going.
People die because of it. So I think laughing about it is it's not cool.
Well, I certainly don't think I laughed at it. I think benzo dependence is pretty much a euphemism for an addiction. And if you know anything about my work,
that's
and
the
me being
problem,
super crunchy and speaking about why I think medicines are bad, because they do create dependencies, which then yield people going onto the streets for something stronger. I mean, the benzo addiction becomes a heroin addiction because the doctor won't write you the prescription anymore. So you turn to the streets for something stronger because your body is dependent on it. I'm sorry that, again, you are offended by this conversation simply because it is your father. I don't think I've been offensive in my life. It's
not because it's her father. It's because what you're saying is wrong, and it's kind of dismissive when she's clearly upset because of the way Candace is couching this in terms of it being like an addiction problem when it's not. It's not because it's just her dad. It's because what she's saying is mischaracterizing the fact that he had a severe side effect to a medication that caused all of these problems. It had nothing to do with being addicted to the drug.
Language, and if you find it to be manipulative, that I think that it impacted the way that men saw him when they publicly were saying that on Twitter. We covered the tweets that people were writing on that day about how they used to idolize him. They're so grateful for his book, but this is not the person that they knew. Again, I'm sorry you're offended by that, but it's just the reality of what happened. And I can tell this is a sensitive topic for you, but it is what it is, Michaela. I don't know what to say. I don't think anybody's laughed at it. I think it's a good conversation to be had. And no one is more anti-big pharma than me. I mean, I have an entire series against big pharma. So
I don't even know where to start with that. Benzo addicts will go to the street for heroin. We were trying to spread awareness about psych med withdrawal. And we were very honest about what everybody was going through. I went through psych med withdrawal myself. It was one of the worst experiences in my life. It kills people, causes akathisia, which makes people suicidal. It's a terrible side effect. So that's what we were talking about. Now, if you want to twist that a little bit and be like, he's losing his audience because he's an addict, I don't really know what to say.
Fair enough. Yeah, let's end it there. So I hope this breakdown was helpful, kind of going into what actually happened to him, why it was so hard for him to come off medications and why the media has just botched it so hard. There was this article, I think, in the New York Post that was talking about, Dr. Jordan Peterson, addicted to benzos, big caps on the top. And really it's headlines like these ones that really kind of misconstrue what's going on with this thing. The people who are having a hard time coming off this, yes, sure, some of them are addicted, but the ones who have a really hard time and come off over years and are nearly killed by it because it's so bad, they have a brain injury problem caused by the drug. And so there you have it. That's my commentary on what happened to Jordan Peterson and why it's so misunderstood. I hope that was helpful. If you think I missed anything, comment below. And also, if you can relate to the kind of misunderstanding that happened to Dr. Peterson and his family because of your own psych drug injury, please tell us about it in the comments below. If you want to learn more about protracted benzodiazepine withdrawal, be sure to check out this video over here where I describe exactly what it is. Thank you so much for watching.